How to Make Living with COPD Easier for Your Spouse or Parent. Brought to you by the Visiting Nurse Service of New York.
Chronic obstructive pulmonary disease, or COPD, is a disease of the lungs that will never go away. But if you can avoid certain risk factors, there are ways to help slow the progression.
Hi.
Hi, how are you?
Fine, thanks for coming over.
Good, no problem. It's good to see you again. Judy's husband was recently diagnosed with COPD, so I'm going to give her a few tips to help make life a little easier for him. With COPD, the first thing I always talk about is smoking. If your husband smokes, he needs to quit as soon as possible. Otherwise, his COPD will just continue to get worse no matter what else we do to help him.
He finally quit. But there are other people in the family who still smoke.
Well, if you can't convince them to quit, at the very least, they need to avoid smoking around your husband. You know, secondhand smoke is dangerous for everybody, but it's especially dangerous for him. Now, let me explain.
Oh, please do.
There's different types of noxious particles, and like nicotine, there are some that we can control. For instance, there's aerosol sprays, like air fresheners and dusting sprays.
Yeah, I probably knew that.
I did. Switch to a pump spray or cleaning cloths, like these. Then you can clean without the fumes.
I should probably avoid spraying pretty much anything into the air, right?
Well, anything with chemicals or fumes. And it's not just sprays. Even cooking odors can make it hard for your husband to breathe.
But my husband loves my cooking.
And you can still cook. I see you already have something cooking on the stove.
Oh, yes.
You want to try to do this when your husband's not around, or open the window for proper ventilation.
I usually just turn on the fan.
Well, that will help. Or you can run your air conditioner or get an air cleaner to get rid of the odors. They're also very helpful with other noxious particles that we can't control, like pollution.
But if I can't control it?
There are ways to work around it.
Oh, I knew you'd say that.
Like paying attention to the daily air quality. You can get this information online or in the news.
Oh.
If the air quality is poor, your husband may feel better staying inside. Also, keep an eye out on the temperature, especially on very cold or hot or humid days.
Oh, he hates humidity.
Yeah, you want to, at that point, make it a point to get all your activities and errands done when the temperature is mildest.
Well, what about air pollution? I mean, we live so close to Ocean Parkway, and there's just so much traffic.
Well, he should definitely avoid walking near there or any other heavily polluted area like that.
You know that sometimes you can actually smell the exhaust right here in the house.
Well, again, running your air conditioner or getting an air cleaner can really preserve your indoor air quality. Part of having a lifelong condition is learning the best ways to live with it and to avoid risk factors that can make it worse. I see your husband's using inhalers.
I think this is the new one.
Well, since each one is different, it's important that he's properly trained on each one he uses. If he's using it incorrectly, he can lose up to 95% of the medication.
Wow, I had no idea.
Yeah. It's also important for you to be sure he's taking his medication regularly. Keeping them on the kitchen table is a great idea. So now he gets into the routine of taking them on a regular schedule, like before meals.
Are there any foods he should avoid?
Well, I noticed you were using peppers earlier. These are all gas-producing foods, like some of the other vegetables or beans or dairy products. And high-sodium foods like crackers or soda and processed foods. These are all things that will make it harder for him to breathe, so he should avoid those. Now, because of your husband's condition, he is susceptible to getting cold and flu and even bronchitis. So it's important for him and the whole family to stay healthy. Make sure he washes his hands regularly or use hand sanitizer.
Yeah, I bought that.
The travel size is great for on the go. Be sure he's getting a yearly flu shot and possibly a pneumonia shot if recommended by his doctor.
I'll make sure he does that.
Great.
Thank you so much.
You're welcome. A diagnosis of COPD doesn't mean your loved one can't live a normal life. Through proper management, you can help them build strength and feel less shortness of breath so they can move around better. I hope you found this information helpful. To learn more about helping your parent or spouse with COPD, visit vnsny.org/COPD. For more tips on caring for your elderly loved one, watch our other videos at vnsny.org/howto.